Welcome to the Poisoning Podcast. I'm your host, Erin DeLullo. Please rate, review, and share this episode with a friend. Today's guest is Jonathan Cohn, a journalist, author, and lecturer who brings a sharp eye to U.S. policy and politics through his work at the Bulwark. He is an award-winning journalist and author of 2 books, both focused on health care. Formerly, Jonathan worked at the New Republic, American Prospect, and has written for the Atlantic, New York Times Magazine, Self, I like the Self one, and other publications. Welcome to the show, Jonathan.
Thank you for having me.
Yeah, I've been doing this for quite a while now, and I may have not mentioned I work with a nonprofit that distributes naloxone, so very well aware of what's going on with opioids, fentanyl, etc. But we've never really delved in to SAMHSA much, which is the Substance Abuse and Mental Health Services Agency, for those who just don't use the lingo in their everyday, right?
Right.
And when I saw your piece and everything that's going on, I thought, we need to talk about SAMHSA. People need to know about SAMHSA. There's a lot of issues in the drug world. So your piece made me think about that. So will you tell us about SAMHSA's role a little bit before we get into your article?
Yeah, sure. So
Thanks.
SAMHSA, which, if your listeners are like, I've never heard of that before,
Mm-hmm.
they should not feel bad. I've been writing about healthcare we'll just say I've been writing about healthcare for a long time. We don't need to get how old I am. It wasn't that long ago it popped on my radar screen. It's one of the smaller agencies in the federal government. It's been around since the early 90s. But starting about 10, 15 years ago, really, as the sort of federal government started paying more attention to the opioid crisis. And we, in 2015, 2016, there were a number of laws passed to sort of put more federal resources behind drug treatment, drug prevention, recovery, harm reduction, the whole spectrum. And someone, you put that money out there, someone's got to manage it. So SAMHSA is the agency that has managed a lot of that. And that's sort of, I think, the sort of top of the list of the things it does is it manages these grants to the states, which then states use or give to providers to help finance. And of course, giving out grants this sounds really boring if you don't, follow government, but there's a lot of tedious but really important work of getting the grants to people, make sure they're being used properly, providing advice to them, and so on, setting standards. So that's a big part of what they do. But they do a lot more as well. They provide training programs. They are gathering information, scientific, looking at the latest scientific information, what works, what doesn't, putting that information out there. And then on top of that, they run the 988 hotline. For mental health and it's the suicide hotline. That is a SAMHSA operation. And they also operate, and I'm going to get the name wrong, and I meant to write it down before I got on here, but there's a annual survey, national survey of drug use. It's the gold standard survey. It's what it's used not just by the federal government, but it's used by state and local governments. It's used by providers. It's used by researchers who are trying to figure out what to do. And it's a really vitally important piece of information, and that is run by SAMHSA. There's an office whose staff is in charge of running that, or at least there was a staff at that office. But we'll get to that in a second.
Yeah, I didn't have time to look it up, but I even believe through Harbor Path, which I work with, we worked with a SAMHSA grant in a state to put naloxone in college campuses, which we know fentanyl is the biggest killer of 18 to 44-year-olds. And college kids sometimes don't make the smartest decisions. They don't know what they're taking. So,
Right.
putting a few boxes of naloxone by a AED in a dorm room is not a bad thing.
I'm sure you know better than I do what a game changer that's been. Getting
It
these out
is.
there everywhere it's huge. And that's, the federal government has played an enormous role in that, and that a lot of that has happened through SAMHSA.
So, okay, with these cuts, how what do you think the current administration's approach is, particularly with substance abuse?
Yeah, well, just to sort of set the big picture here, just, kind of
Mm-hmm.
the context. Obviously the Trump administration has now taken over the federal government. President Trump won, he brings in his people. He's appointed Robert Kennedy Jr. to
Mm-hmm.
run the Department of Health and Human Services. And the sort of, the proclamation, the slogan, is Make America Healthy Again.
Yes.
And if you paid attention to any of the confirmation hearings for Secretary Kennedy, a lot of that was about, his views on vaccines, and that was very controversial. But he did talk a lot about making America a healthier place. And he said he wanted to reorient the department, Health and Human Services Department, around that. Now, Health and Human Services is a vast department, and it's actually the biggest by dollar spend in the entire cabinet because, among other things, it's this what covers Medicare and Medicaid, which covers, it's health insurance for like almost half the third, I got a lot of the population. Um, but so there was a feeling that he was going to make it reoriented around health. And then, in addition to that, the Trump administration made a very big deal. They're trying to make make the government more efficient. You may have seen Elon Musk around, Department
Mm.
of Government Efficiency, and they had all these plans to make the government more efficient. And that all sounded, if you take that at face value, who doesn't want to make the government more efficient? Every agency in government could be more efficient,
Sure.
and certainly we all want to be healthier. What has happened, though, is there have been a sort of series of quite dramatic just staff cuts.
Yeah.
They are getting the Department of Health and Human Services as a whole, reducing it from basically 25% reduction in this department. Um, and that includes, as part of this reorganization, they're taking SAMHSA and some of the other smaller agencies within HHS and kind of collapsing them into one that's going to be called the acronym is AHA, and I want to say it's the American Health Agency. Is that right? I have to go
Okay.
look that one up too. There's so many these acronyms, bouncing in my head right now. These last few weeks, but it's AHA. That part I do remember.
Haha.
AHA, not like the band. For those of you who are old enough to play,
The theme
Take
music.
on Me, and the animated video. And again, in theory, are there ways to sort of significantly cut the staff of HHS and make it more efficient? Maybe does that involve consolidating some agencies? Sure. I mean, it's a big
Yeah.
organization, like any big organization, you can find waste in it. But there's really no sign that that kind of thought went into the process.
Mm-hmm.
Really, there's been a series of cuts, and they seem to be almost arbitrary. And there doesn't seem to be a lot of thought given to where they are cutting. And so we have seen a number of cuts at within SAMHSA. And I'll mention it. You're going to hear me say, I believe this has happened, or I think this has happened, because they didn't. It's not as if the Trump administration has actually put out a very clear list of what they've cut, which is unusual. Usually the federal
Mm-hmm.
government is pretty transparent about these things. And B, I think another sign that this isn't a very well thought out effort. So what journalists and I, like me, have been able to do is we're like on the phone and we're emailing with people like, well, how many people were cut from this office? Are you sure? So, I mean, no one's entirely sure what's going on. We do know that before this latest round of cuts, there were proposals circulating to reduce the staff of SAMHSA by anywhere from a third to two-thirds. It's hard to get an exact number of how many were cut now, but it was very substantial, and some whole divisions were wiped out. So, for example, we were talking earlier about um, this study, this very important national study that's like the gold standard study that we all, that researchers and government use to guide their treatment efforts. My understanding, the entire staff that was dedicated to managing that study is gone.
Mm-hmm.
They laid them all off. In addition, SAMHSA, like most of HHS, in addition to having, it's headquartered in Washington, D.C.,
Mm-hmm.
in one of the less attractive federal buildings in Washington, D.C., which is saying something, but, it's got HHS headquarters. And then there's been 10 regional offices around the country. And, these regional offices are important for any function of HHS. I happen to speak to some of the people from SAMHSA who were in these regional offices. And, they would tell me that, a lot of their work was kind of going out into the, the states that they sort of sought over, and trying to get out to the state officials, to the local officials, to some of the big
Yeah.
providers 3 or 4 times a year. Partly that's to be, sort of responsible stewards of the federal government's money. Is this money being spent the way it's supposed to be spent? But a lot of it is also, there's a kind of back and forth, like, hey, we have this new initiative, if you want to take advantage of it, you at the local level. And there's a bit of a feedback loop also, where they would go out into the communities. And that's where they would sort of pick up things like, hey, people are using fentanyl in a different way than before. We're seeing a rise in this
Right.
particular kind of drug, or we've noticed this particular, a group of people seem to be vulnerable. And that information would filter its way back up to the national headquarters, and you'd get this ongoing conversation. So kind of almost like an early warning system, or it would help, to sort of tailor their programs and treatments. So, that was the sort of role of these regional offices. Well, there used to be 10 regional offices. They've wiped out 5. So that leaves 5. Look at me, I'm like Sesame Street
Okay.
with the counting. But they've cut them in half, and they've cut the staff of the ones that are remaining. So I mean, you can think in your head. I mean, there's one way or another, that's going to be less contact, through the regional offices, and so that is going to hamper the ability of this agency to do what it did. So I just described that feedback loop. Well, it's not going to feed back so well anymore, right? And it's going to be slower for information to
Totally.
get back and forth. It'll be harder to get, if you're the sort of head of the sort of mental health department, which handles substance use disorder programs in, let's say, in my state, Michigan, which is where I live.
Yeah.
Now it's going to take you an extra 4 or 5 days to get answers to things. If there's problems with payment, it's going to take longer to process those. And that actually that's one of those things that, again, I think if you don't know how government and the nonprofit sector works, you might think, well, whatever. Okay, so you get your money 5 days later or 8 days
Yeah.
later. You may know this. So many of these programs are like, there are no margins in their budgets, right? They're like, the money comes in, it goes right out the door to pay the rent, to pay the
Yeah.
payroll. You delay payments to some of these people by a week, they will shut down. They will not have, the money. And even if they are able to open back up a week later or 2 weeks later, I mean, just in human terms, I mean, you miss 2 weeks, and you miss some people who, could have been helped, and you may not get a chance to help them again.
Yeah. In my personal life, yesterday, I sit on a grant committee, very small grant giving committee here in West Virginia. Will be a name where the committee was reviewing grants. And we try to find groups that are sustainable. And one of the applicants noted that they had received a federal grant. And I think I might be a little more up on news and policy just because of my job and everything. We had one of the attendees say, "We need to find out. A federal grant means nothing these days. Did they really get that? Are we really matching that?" Like, that was the sense in rural West Virginia. So, but that affects these other small little groups that need money and funding to continue their work. Oh, it's been an interesting start to the year. And we're just April 3rd, right? Yes, April
Yeah,
3rd.
so it's only April. So what is it? What's the one from 30 Rock? It's only Tuesday, Lemon.
It's like one of my favorite shows. Matt and I are rewatching it right
Right,
now.
right.
So great. It's only
Great show.
Tuesday.
I'm a huge Tina Fey fan, so
Oh,
that's
the
my way.
best. Okay, I cannot laugh. This is fair. It's been a week.
Yeah.
So,
I actually think for all of us, I mean, you need to find some laughter where you can. I mean, we're not going to get through this, so.
yes, exactly. Well, so you let's talk about this human element, right? The human impact. And maybe even talk about the word empathy, which I guess Elon thinks is used too much in our society. And we've lost a lot of people in the opioid crisis, right? A lot. And I did an interview with David, and I'm going to butcher the last name because I hadn't had to say it in a while. Ovale of the Washington Post. He's one of the health reporters. And, this is a historical tragedy, right? 700,000 Americans lost to first oxy, now synthetic opioids, and it's just continuing. We are seeing a decline in overdose deaths, but are we becoming numb? Is like 50,000 deaths a year just like okay to folks?
Yeah, that's a really interesting question. You wonder about that, right? I mean, there is always
Yeah.
a normalization process, right? When something's been happening long enough. And now that it does seem to, we are kind of seeing this decline. And I think there is always a danger that, people kind of ease up, right? That the
Yeah.
attention wanes. Um, and, um, and there's any number of reasons that can happen. Thinking about this and just thinking aloud, because this is a really good question, but sort of two things occur to me about what might be going on here, because I do think it's getting less attention. Um, I think number one of the reasons it did get as much attention early on,
Mm-hmm.
was because it really just sort of defied a lot of the stereotypes of who is prone to drug problems. And you're in West
Right.
Virginia, so I'm not telling you anything you don't know, and of course you know this in
Mm-hmm.
general, but the fact that this hit in so many kind of rural and working class areas, that defied a lot of stereotypes of who and where it was, and politically, as a political phenomenon, certainly had a real capture on both sides and both parties. I mean, we're used to, and this is, I want to be very careful before I say what I'm
Yeah.
about to say. I am not saying there's like one side of the political spectrum that's more empathetic or less or inherently kind or whatever. But, historically in debates in this country, certainly, right? The sort of Democratic Party, the Republican Party. Democratic Party has been the one to tend to sort of say, think of the people who are, think of people as victims of drug abuse and sort of what can we do to help them. The Republican Party has been more seen as a kind of morality test and a kind of law and order issue.
Mm-hmm.
And this scrambled things, right? And those of your sort of viewers and listeners who are political buffs may remember a couple of like key moments. I very much remember Chris Christie, the former New Jersey
Yeah.
governor, really talking a lot about sort of giving I think it was a town hall. I want to say it was in New Hampshire. I might be missing that part at one point when he was running for president and gave a very moving story about the sort of the human toll of this. And I think that got people's attention because, it didn't fit the normal pattern. And of course, they were seeing it everywhere, right? I mean, you were seeing
Yeah.
it in so many places. And we can talk about this in a second. I mean, even Donald Trump, when he ran for president, first time, this was a big part of his campaign. And, in his first presidency, he would talk about it in a way that certainly by Donald Trump standards, I think had a kind of note of empathy we don't often hear from Donald
Mm-hmm.
Trump. Um, and I feel like that, that political constellation has changed. I don't feel like we are hearing as much of that sympathy, empathy on the Republican side as we used to, and we can talk about why. But I feel like that is probably a bit of a part of the pattern. And then, as you said, I think there is some complacency setting in of this is getting better, and it is like the numbers are coming down, which is
Mm-hmm.
fantastic. And I'd be love to know what you are hearing and seeing. I will say the people I talk to who study this, this is a new phenomenon, right?
Yeah.
Last 2 years, and takes a while to figure this out. I mean, the general theory I heard was that there's about 5 or 7 different things at
Yeah.
work here, some of which have nothing whatsoever to do with an intervention and everything to do with things like the normal cycle of these things, changes in the sort of market value and street purity. But I do think most people I talked to, at least, did feel like this ramping up of resources, attention from the federal government and state governments and local governments has made a big difference. And the danger, right, is that we get complacent and we pull back, and suddenly that support is gone. And, at best, the decline slows down. At worst, we actually start to boomerang back up.
Yeah. Oh, I'm very much worried about that boomeranging. Very much concerned. With the decline. So there's the morbid thought that this, heavy users with a more potent fentanyl are gone.
Yep.
They're gone. But, you know, I also hear so many stories of people being revived because of the access and acceptance of naloxone. I mean, a few years ago, you couldn't be, people in West Virginia thought having it on them meant they might be suspect for having drugs, or, it attracted drug users to them. But it's just been taking the stigma away from it and saying, this is a resource, that it's a Lazarus drug. It can bring you back like that. But it doesn't help if it's sitting in a storage facility somewhere in a government building. It has to be out in society. And it's very, it's not expensive. It's not an expensive medicine to distribute. So that's a key too. And we do live in cycles, right? People have seen the trauma, seen the hurt that illicit drugs can cause, and maybe they make decisions to say, maybe that's not for me. I saw family member X go through this. So, but we won't know until we see more data. And I don't know if you bring up the centralized data, and it's not, is the health department in Montana gonna connect with the health department in Colorado or California even and share data? No, maybe having a neutral, centralized place is not a bad thing for this data. I don't
Yeah.
see how state and local just naturally share it all around the country to see what's working.
Yeah, well, that's such a good point. I mean, look, I'm a political policy writer by
Hmm.
trade, and this is one of many topics I cover. And, I would say one of the kind of ongoing themes in every issue I've covered in policy, healthcare, education, et cetera, again, we'll call it beyond 2 decades in this business. And really going back through American history is this ongoing debate of the balance between how much should the federal government do, how much should we leave for state and local
Right.
government. That's a healthy debate. I've always said, I think
Mhm.
that's a very healthy debate. And I think people, reasonable people with similar values can disagree on any one issue. Whereas, how much should the federal government do? How much should the states do? And there's a give and take, and depends on the program and the people and what you're talking about. So that's a healthy debate to have in a country like ours, and we should have that debate. But there are some things, even if you think the government should be much smaller than it is,
Yeah.
um, there are some things that only the federal government can do. What you were just describing, that communication across states, the gathering of data, the resources. The state of Montana can't do that. You're absolutely, there's no way the state of Montana can do that. And, you know, let's be honest, in a world where we leave a lot to the states, there is going to be a lot of variation in the states. Now, that might work out well if you happen to live in a state where the particularly kind of attentive, enlightened leadership, which can be anywhere, and that doesn't always correspond to red and blue, by the way people
Of
sometimes think it
course.
does. I
Of
mean, there's
course.
I always sort of point out that, well, no, and I mean, people are often surprised when I sort of rattle off names of states that are particularly good at this service or particularly bad, and they're like, "Oh, I would have thought that was more Democratic or more Republican." Um, but one of the jobs I've always felt like, and this is a bit more of a philosophical debate, obviously, but I have certainly always felt like that part of the job of the federal government to say, look, we can have some variation on the states. We do want to kind of set a basic floor and guarantee that floor everywhere and intervene where we have to if the state isn't going to get up to that level on that own. And to me, an example of that is, providing Narcan, right? Which to me is like, that is, I write a lot about healthcare, other issues. So I'm
Yeah.
used to writing about things where we can't cure them, things we can't
Yeah.
fix. We can't, poverty is hard to fix.
Yeah.
Many cancers are hard to treat. Diabetes is a whole lifestyle. And
Mm,
these are big, burdens on society that government could do everything right. It would be still hard to fix, and frankly, government usually doesn't do everything right. Frequently does a lot wrong. But this we can do. We know how to do. We
mm,
give the people the Noxalon.
yeah.
And as you call, I've actually, the Lazarus drug. I mean, that's a magical sounding name, but it's true. And so, if you can get that everywhere, I mean, why wouldn't you?
Very low cost. And having data drives policy decisions. I even feel it. I mean, even if maybe the data, let's say it might be corrupted somewhat, right? Nothing is ever perfect, but having advised elected officials, they love seeing data because it gives them a reason to make a certain decision.
Yeah.
And without it, I just wonder if people go, well, don't know if I want to do that.
No, that's
So,
a really good point. You need data, it's the one of the least sexy parts of government, right? Because you're not providing the service, right? You're not answering some question,
yeah.
you're just doing research. It's a bunch of, you know, data nerds, right? And I say that someone who's, has many data nerds in my life, so that was meant generously, not as an insult. Um, but if you're looking to cut, right, where's the efficiencies? Well, we got like 10 numbers crunchers here. We could do with four, well, we don't need those people. But data is you need the data to make the government work. And you need the data to make it effective. You need the data to sort of stop the waste and the abuse. I mean, that's part of one of the ironies here is, and I'm hardly the first person to say this, but one
Mhm.
of the motivations behind these cuts we're seeing under the Trump administration, with Elon Musk and the Department of Government Efficiency is we want to cut waste and abuse and fraud. Thing is, sometimes you actually need more people in government, not fewer people in government to stop the fraud because you need something to watch over it. Not always. Sometimes, look, sometimes there's redundancy. Sometimes there's, we need to downsize. That's the reality. But again, data to me is an example. Data is it's the data the way government holds programs accountable. And by the way, we as taxpayers and voters hold the government accountable. I mean, we use it's people in the private sector who use that data. And very frequently, what ends up happening is the government collects the data on a program, does the program for a couple of years, and then researchers out there will go out there and say, this isn't working. It's it's very inefficient, or it's actually it's having some adverse consequences. And so we as taxpayers and voters can then say, hey, get rid of that program or change it. And so data doesn't always lead to a larger government. Sometimes it leads to a smaller government, or at least one way or another. Hopefully, it leads to a better government. But you need the data.
Exactly. And the National Study on Drug Use and Health, I think it was published on the 31st of March, right? Which, I mean, people need to think the survey includes 12-year-olds. Like, this is how serious drug use is in our society. And that department, the next day, a few days later, is gone.
It's gone. Yeah.
It's
And
gone.
again, no one said the survey is stopping. They just fired all the
Right.
people who run the survey.
To have all the institutional knowledge.
That
No,
is,
okay,
so
not
I'm so
laughing.
glad you mentioned that because I do think that's part of what's missing in this conversation is, I mean, I'm not here to beat up on Elon Musk, but
Mhm.
one of the his things, he has said, people, because, they've been cutting everywhere, and then it turned out, I don't know, there was very visible ones where they cut air traffic
Yeah.
controllers, they cut the disease detectives from the CDC, and people were like, you really want to do that? Like, we need those people. He's like, oh, we can hire them back. We can hire them back. Well, you can't really just hire people back, because once people, even now, even just with the message going out, lots of people are looking for other jobs. You lose these people. Even if you are able to refill those jobs and backfill those jobs with the people, losing that institutional knowledge is just that you can't replace that. You can't it takes decades to build that kind of thing up. I mean, it's any organization knows that. Public sector, private sector, institutional knowledge is incredibly valuable. It's hard to quantify, but it is, you get rid of it at your own peril.
We do. We do. And, you know, well, you're aware of my husband, so you know his writings. And,
You do.
um,
Big
we
fan.
have somewhat similar philosophies. Our oldest is named after Edmund Burke. Our youngest is named after um, Beckett, Saint Beckett, and William Wilberforce. His middle name is Wilberforce, and I call him Wilbur. So we are these, Burkean, I guess you could say conservatives, or classical liberal types. But, I was raised thinking like, oh, drugs are bad. Bad people sort of do drugs, but they could stop easily if they wanted. So until I was working in this opioid crisis, did I really see what like opioid use disorder does, how awful this epidemic is. And it's easier in this country to buy legal drugs than it is to get recovery. So we aren't really doing it right. And I had a gentleman from Michigan on the podcast a few weeks ago, Ron, French from Bridge, Michigan. You've probably heard of the local publication, Bridge.
Oh
Maybe,
yes,
maybe
oh
not.
yes, yeah,
Yeah.
yeah. No, the
Okay.
Bridge, great, actually great publication. You want to
Yeah,
learn about
I mean, I
Michigan?
can't believe this story he wrote, and he's been doing some great coverage. But we have all this opioid grant money out there now, and not every local county commission can figure out how to spend it in the right way, or they're not getting enough of it to actually do the things that need to be done to help people. I think even one of his stories was in the UP, a new recovery facility opened, and there was a waiting list before it opened.
Wow.
But that's what I see. That's what we live in. And so for me, as a conservative, I think for our society, we have to help people recover. And all of this data and all of this grant money is part of that because I don't see people just taking checks out of their own or money out of their own pocket and helping someone that way. It's just not. It doesn't work that way.
Yeah, no, I agree, and I just one of the many things that is sort of observing this play out right now with again with the Trump administration and the changes from Elon Musk, um, there's a lot of energy being put into just firing people in what seems to be at best a haphazard way, and at worst seems to be a completely arbitrary way, um, and that energy could be spent actually looking, seeing, what can we do to do this better? I mean, I don't think anybody thinks the way we sort of, finance and manage this right now is ideal. I mean, there's some good things happening for sure. And, I think they do, a lot of
Yeah.
heroic work, but so many things we could be better. I mean, you got the energy, you got some smart people, go, there's the, go out and read articles like that and see what's happening, out in the real world, in different parts of the country, speak to people, interview them, or even, spend some time, the thing about the government is it does examine itself constantly. There's the general accounting office. There is, or at least there used to be, inspectors general at all the departments. There's congressional committees that will sit and study what's going on in the various federal agencies. There's no shortage of information on what the federal government is doing, inadequately. Um, and a sort of good faith effort to address that would be terrific. And, there is no reason why the Trump administration could not be putting its energy into that. I'm sure there are parts of that agenda that would line up quite neatly with the sort of broader philosophical beliefs that are in that administration. Same thing if it was a Democratic administration, right? I mean, no matter what, I mean, there's going to be things they want there's going to be recommendations. They'll say, yeah, that makes sense to me. I'd like to do that. This is not, all it would take was a sort of good faith effort to try to make government work better, to try to make our opioid programs more effective. And I just don't see that in this effort. And again, coming at a time when we do feel like we do have, we do seem to be turning a corner. We are seeing progress. We have new tools to not be taking advantage of those when literally tens of thousands of people, their lives could be saved. It's just heartbreaking.
It is, and RFK Jr. should see this. He's a former addict himself in recovery. I've watched the documentary he put out when he ran for president. I don't know if he's just going along with what Elon wants. I mean, he says he wants to help people recover. I just want to see that plan.
Yeah, you and me both. It's hard to know, what is going on there in particular at HHS and with him. Um, I don't know. I mean, speculatively, I could say a few things. I mean, I think like any secretary of any
Yeah.
department, they're the things he really cares about, and he's going to put most of his energies into that. I think we know this was not exactly a secret that vaccination is, something he
Yeah.
really cares about. And so I think that's part of what's going on. I think he comes to the department um, uh, with an agenda that is with a suspicion, a distrust. I might even go so far as to say a contempt or disdain for the sort of both scientific establishment and the sort of career officials at the Department of Health and Human Services, many of whom are scientists.
Yeah.
And so insofar as I mean, if you think about it, the way the federal government usually works is if a secretary comes in and wants to implement an agenda, there's usually, and it doesn't sound like what the people who are the career people are there think is a good idea, they'll push back and they'll say, we think this is a bad idea. And typically at a department like HHS, that may or may not change the course of action, but they're going to get listened to because people say, well, you've been doing this for 20, 30 years. You've got all these credentials. I'll listen to you. And you might not agree as a secretary, but you'll hear him out. I don't get the impression that he's got that kind of open mind to be listening. So there's really no one to push back at him. On issues when it comes to sort of, substance use disorder in particular, you're right. He's someone who's been through recovery and treatment of some kind. I actually don't know what his sort of personal story is that well, so I shouldn't, speculate on what step,
Yeah.
what pathways he went through. But I do know that he has said many times, he is more he is skeptical of a lot of anything involves medication.
Right.
He is much more into these farms where you go, and sounds to me a lot more like the people can do this on their own if they just get tough and just more like let's give people the tools to pull themselves up by themselves, which for some people that's going to work, but for some people it isn't. And so it would not surprise me if, there is some mix of those things going on combined with from the outside, just a mandate to just, we want to get rid of, we want to downsize this department. We're trying to downsize every department.
Yeah.
And again, it's a 25% reduction. So I mean, that's just, that is a massive, like in one fell swoop, basically, or in the span of a couple months. I mean, to take one of the department that's sort of integrated into so many aspects of American life and just sort of cut the staff by a quarter. I mean, when this was announced, these changes, Secretary Kennedy, he had a, I'm going to paraphrase a little bit, but he said something along the lines of, we're going to go through a painful period, but we're going to show that we can do more than less and nobody will be left behind. And I just find those last
Mm.
two statements, I mean, he's right about the painful period. The rest of it, I just find that difficult to believe. If this were a 5 or a 10% reduction over time and with careful planning, sure. But 25% reduction that seems to have no rhyme or reason in the span of 2 or 3 months. I mean, come on. I mean, what are we talking about here? How could that possibly not leave anyone behind? How could it possibly lead to doing more rather than less? So, but maybe I'll be proven wrong. I mean, maybe I'm
Yeah.
just a skeptic.
No, I mean, I hope my skepticism is proven wrong too. There were a lot of parents and family members of fentanyl and opioid poisoning that I've dealt with, and a lot of them love President Trump. They're like 110% behind him, and some of them were, affected by the Sacklers and Purdue Pharma early on in the crisis, and they were
Right.
hoping that the DOJ would really hold them to task, and that hasn't come true. He does talk strongly, and he is tariffing fentanyl, right? That's what it seems like. But I think, demand side has to be met as well. It can't be just supply. It's not like, oh, we'll just take it away. Everything will be fine again. I wish that was the case. We've been trying that for decades.
Yeah. Yeah. Well, and there's been a change, right? I mean, we talked about this
Yeah.
earlier, but if you listen, I mean, I remember there was a speech he gave at the White House in 2017 when they announced they were going to declare opioids a public health emergency, which is like, gives it certain status and, frees up some money, et cetera. And the speech he gave was, it was again by Trumpian standards, I thought a pretty, empathetic speech. And he talked about, it was really, it talked a lot about the human toll. And he actually, I thought was interesting, his brother was an alcoholic, I believe, or had, alcohol
Yeah.
issues. And so he's talked about that before, but he kind of talked about his brother's difficulties with alcohol and as a way to kind of personally connect to this issue, which again, for Donald Trump, who never does that, I thought was quite notable. And, maybe it was authentic, maybe it wasn't. I don't know. I can't see into the man's soul, but, it was there at least. He is still talking about opioids, but now it is all about, fentanyl as a foreign threat. We need to go after the countries that aren't cracking down. We need to shut down the border, and of course he's using it as a pretext for a lot of his immigration acts. And again, just to be clear, my understanding seems right to me, which is that, if you're thinking about an overall government strategy to combat the opioid, epidemic, absolutely you want to be, there is a foreign relations part of that. There's a national security part of it. There is a, going to work and sort of, interrupting the international supply lines. I mean, that's all necessary. That's not, that's you want to do that. But like that is not, by itself gonna solve the problem, and that's all he talks about now. So I've noticed that change in his rhetoric, and
Right.
I think that's unfortunate.
Yeah. Well, it's early. It's early on in the administration, so we can see what else RFK and Trump do with the drug issues that our country is faced with. But I ask every guest on this podcast if they carry naloxone or have it in their home or office. So do you?
I do not. But
Okay,
that
we're gonna
is
have to correct that.
yeah, no, that is actually, it's funny. I never thought about it. And yes, you're right. Absolutely. I should. I live in a college town too. So, that's all the more reason.
It is. You never know when you can help someone.
Yeah.
So, Jonathan, anything else you'd like to promote or tell us where we can find your work?
I just started at the Bulwark. I have a newsletter there that's called The Breakdown, which is about policy, and that's where I wrote about this. So, I encourage people to check that out if they can, if they get a chance to. And the rest of the offerings, the Bulwark, it's a great publication. I'm excited to be there.
Yeah, that's great. Well, thank you for coming on The Poisoning, Jonathan.
Thanks for having me.